Welcome to Sage Women, the podcast for midlife ladies navigating perimenopause, menopause, and healthy aging. I'm Melanie White, and each week I talk with experts and women sharing real stories, practical insights, and smart tips to thrive through this stage of life and beyond. I'm really happy to be back here on the Sage Women podcast with Therese Liu, Pharmacist Edit, and who has some really interesting things to talk to us about today. And I suppose two areas that we'll be covering is the fact that we know women have been historically underserved in medicine, excluded from clinical trials, and left with more generic one-size-fits-all solutions. So today what we'll be talking about is the need for personalised health. In this era of AI and technology, we have so many options available. So leading into that conversation, I will say hi to Therese and thank you for being here.
My pleasure, Melanie. So I'm a pharmacist, health coach, and researcher. So I help my clients make sense of their health so they can make confident and empowered choices, especially through the changing seasons of postmenopausal. So I try to use science, evidence-based strategies to customize it to their individual circumstances. So if anyone's felt overwhelmed by conflicting advice, one day eggs are good, the next day is evil, HRT is a must, then suddenly it's dangerous. So I think you're not alone. Like Mel's mentioned, that midlife is very noisy with so many conflicting opinions, but quiet on personalized truth. And I think our mission is to change that. And having lived through chronic illness myself and having worked with clients navigating fatigue, belly fat, anxiety, hot flashes, brain fog, I've learned that medications, it can be life-saving and has a place, but it rarely addresses why the imbalance exists in the first place. And that's where I love to work, like bridging the evidence between allopathic medicine, which is really good in regulating symptoms, with the wisdom of holistic medicine to uncover the root cause and make changes that is sustainable and intergenerational.
Oh, I love that. I feel like we could talk here for about 3 hours, Therese. You've got so much wisdom and knowledge. And before we dive into that, I'd love to know a bit about your backstory. How did you become the pharmacist and health coach using really precision and personalized techniques that you are today? Like, what is your journey to this point?
Yeah. So one of the many hats I wear is as a medications review pharmacist. So in Australia, GPs can refer me and I see patients in their homes and I review their medications. I check for interactions, side effects. And that's every healthcare practitioner knows that diabetes medications, it doesn't cure diabetes. Antidepressant doesn't cure anxiety, depression. So I make my way and review the medications. We go through, what they think is the cause of their health issues. And I see so much suffering and all the consequences of chronic illness. So we're very good in managing chronic illnesses, but I felt like it would be lighter. So as a health professional, it can be quite dark and burdensome when you see a patient with 30 different medications, with multiple chronic conditions, and there's so much you can do. And so I wanted to work on the lighter side to actually do health and wellness before, the writing on the wall, before it gets too late, because there is a point of no return where the fire of inflammation, if it just goes on, it can cause permanent and irreversible damage. So I must attribute like what I'm doing to my clients, especially one where I visited in rural Queensland, and he was a patient with diabetes. He had his foot amputated, and we went through like this medication, how you really need to drink water because it makes you pee sugar. So I went through the whole shebang about the benefits of hydration. And so after 5 minutes, I thought I did my job. And every 2 years, you get to go back and discuss medications again. And I went back, and 2 years later, the wife's mentioned, her husband, retirement age, they moved to rural Queensland to be closer to family. He's got limited movement. His mobility is still affected by, he's wearing a snow boot, etc. And he had recently been discharged from hospital for acute kidney failure. And if you ever actually experience that, it's one of the most horrible experiences. You just feel you want to pee, but you can't actually pee. And so I was like shocked because I thought, one of the contributing factors could be inadequate hydration. So the kidney is one of your most unsung heroes. And to actually have an acute kidney problem, it is saying that whatever information I provided, it didn't really hit the mark. And I felt like I really owed it to this client to understand why the current medical system was not serving him. What was I doing wrong? And so I enrolled in the health coaching course, thinking, you need to do things differently to get different results. And when you go and do this training, you have to bring your own sort of like habits that you want to change. And so I'm the sort of person that once I start eating chips, once I start, I can't stop. And so I brought it to the table. And my trainer was like doing the whole health coaching model, reflection, like, what am I getting out of it? And then sort of like, giving analogy. So you're getting a chip hug. And I just got so angry that, why do I have to rely on chips to actually give me that hug? So I knew from that day onwards that health coaching, it helps reflect, it puts the mirror out there so that the client is in the driver's seat. Whatever you say is not going to change unless they want to change. But what I can do and assist is to ask the right questions so that they can actually see why they stuck. And then help them understand how they can actually shift themselves. So this model is more efficient. It makes more sense. It works more efficiently, and it's also sustainable.
I can really hear you bringing together the blend of skills, and that must have been heartbreaking to be working with a client, providing information that he didn't, for whatever reason, take on, and then realizing actually there's a better way of communicating and interacting with the client in that it's not information, it's helping them gain insight, and that's helping to implement new habits that could make a real difference. And isn't it interesting that it's, there are people on medication, but there are also some really simple things you can do that might prevent your condition from getting worse, or might support you to have a better quality of life through
100%.
treatment.
Health can be really simple if you have the right team around you. We outsource everything, like meal preparation. We outsource it to HelloFresh, etc. And so there are times when we actually engage with the right team, whether it's a health coach, actually has experience in whatever result you want to achieve, then makes life a bit easier. You get to learn the shortcuts and the mistakes from others. So I agree that health can be very easy if we actually know what to do.
I want to pick up on something you said earlier too. You said there might be people on 30 different medications. Is that real? Are there people actually taking that many? That sounds like a lot.
Unfortunately, when you start with one medication, you could be adding another one to actually manage the side effects from the first one. So in medicine, we call it a prescribing cascade. And what I'm beginning to see, because I'm still doing this medications review work, there's a lot of drug-nutrient interactions. So an example is like metformin, which we use as one of the first-line treatments for type 2 diabetes. And so when you are on long-term metformin, because the way we process it, it steals a lot of B12. And so some people get like pins and needles, and they think it's the progression of type 2 diabetes, and then they add something to actually help manage the neuropathy or the nerve pain. But in fact, like if we actually unpacked it further, it could just be as simple as just adding like B12 into the mix. So unfortunately, the way the current system works, it really rewards like the use of medications. You can get on the PBS, and there's no sort of really rewards for addressing the diet and lifestyle change, which is something that we can take control of, and it's as cheap as chips.
Cheap as chips. I like you bring the pun back into the chip.
I love anything to do with chips.
Me too. But isn't that so fascinating and so alarming? I mean, how many people are on medications that they potentially don't need?
And I think that's why with podcasts like yourself, we can break the glass ceiling, because it's knowledge and the grassroots movement, and also the support of every other practitioner, whether they're a health coach, a doctor, nurse, pharmacist, exercise physiologist, physio. The more we actually are aware of the contributing factors to inflammation, and trying to again customize it to the individual. And then when we see the results, we know that it's working for the individual.
I feel like asking you some questions on inflammatory pathways without getting too technical, but maybe before that, could you tell us a little bit about the genetic testing that you do and how that works? Because I know there are a lot of women going through symptoms, and the work that we've done with Michael Liebman says we need to understand the cause of what's going on, not treat the symptoms. So that's kind of some backstory, but tell us a bit about that test work, please.
Certainly. So it's one of the many strategies I have. I have over 50 different strategies. And what we need to think of with DNA is that it's your body's instruction manual. It's written in 4 letters, A, T, C, and G, and you inherit half from mom and half from dad. And together they create a one-of-a-kind blueprint for how you process nutrients, how you handle stress, how you detoxify and respond to medications, even how you sleep. So there's 3 billion letters in the code that is from the Human Genome Project, and we're still learning about how they interconnected and the biochemistry and the pathways. And we're learning, and in this space, you get massive emerging data on a regular basis. And so when we look at variants, the way I look at it, we're looking at non-serious consequences, where we look at single nucleotide polymorphisms or SNPs, which are harmless. This is different from the serious kind that you see at clinical geneticists. So I'm not a clinical geneticist. My role is to educate and to provide a framework on how to interpret the reports that come out from the DNA reports I use. So it isn't a fortune telling. It's in context. It helps us to answer why certain strategies work for one person and it backfires for another. For example, I had a client, let's call her Lisa. She's 45 years old. She's perimenopausal, a strong family history of cancer, and she carried the ApoE gene, which is the higher risk for dementia. And she had an autoimmune condition. She had hypothyroidism, Hashimoto's. She wanted to boost her energy naturally, and she didn't really want to use too many supplements. And also, she wanted to focus on whole foods, less on supplements. So when we did her labs, it showed that she had some inflammatory markers, and it hinted at low protein intake. So we increased her dietary iron. She doesn't really eat much red meat, but when she did, we said to add maybe a bit of lemon juice, like a bit of vitamin C for better absorption. We reminded her to separate her iron from coffee, nuts, and seeds, which can sometimes block the uptake of iron. So over 12 months, we work, her stress regulation, because your thoughts are chemicals and it contributes to a bucket of inflammation that you've highlighted, Mel. And so she attributed the work we did together in prioritizing protein in managing her stress levels and getting the data from her genetics. So she didn't want to do supplements, but we found that she had a mutation called a SNP called the TCN2, which was homozygous. So she couldn't really absorb B12. So we had to be really mindful of the type of supplement we use, and different persons they respond either to intramuscular injectable B12, or some require can get away with sublingual, which is under the tongue. So we try under the tongue like B12, and there's 3 different types of B12. So with her genetic profiling, we found out that hydroxycobalamin would be the best one for her. And so she had that, and over 12 months, her energy and her thyroid markers improved. And most importantly, I think her confidence, came back again. That her diet, she was on track. Once a week, iron. Let's meet halfway and maybe try this B12 supplement. We tried the awful ones, like the ones that's got the blood, the spleen, etc. 12 capsules a day, but it wasn't as useful as the hydroxycobalamin, like the B12 sublingually. So I suppose it was the knowledge that we placed here and helped her to do life in her own terms, because she preferred a whole foods environment, and it was about trying that first and then moving forward. But we always bring the doctor in the picture, where we actually only can control what we measure. So her thyroid panels was important, and also her energy levels gave us the green light that we were doing the right thing for her particular genetics.
It's such a great example of getting to the heart of the matter quickly, isn't it? I mean, she's come to you with a range of things going on, and without that kind of test work to guide you, you'd be going, well, where do we start? We're going to test all of these things, and it becomes a huge, complicated, and potentially expensive exercise that's going to take a long time to figure out, and a bit of detective work and perhaps some trial and error. But I think what I'm hearing in this case is the ability to do a test that gives you certainty around what's going on, where some really obvious starting points are, and even down to personalizing what would be the best, what are the nutrient needs, or what are the most specific conditions that need to be focused on.
Yeah. And I was just going to again caveat that with DNA testing, there's 30,000 like different variants that we can actually come up with. I mean, 30 million and more. And the current like genetic sort of like companies giving us maybe 6-7% of that. We haven't got the full picture. But I think maybe in 5-10 years time with AI, artificial intelligence, and more practitioner experience, we're going to have the full picture. So it isn't magic and it's not destiny, it's information. And that one of the things that we always say is that the genetics might load the gun, but it's diet and lifestyle that really makes the difference. And we know from the Danish twin study that twins who have the same genetic material, when we look at their longevity, sort of like outcomes, even though they share the same genetic material, they could have different like diet and lifestyle approaches, and that 80% was attributed, the outcomes they got for longevity was actually epigenetic, was environmental, diet, and lifestyle. So the good thing about DNA analysis is that the information that we're getting is things that we can actually work upon to improve that. It's not set for life, that just because you've got this genetic predisposition like the dementia, the APOE gene, doesn't mean that you're going to be slapped with that disease. And even if you didn't have the gene, doesn't mean that you won't actually have like the dementia as well. And that there is so much like power and control that we can actually give to our clients.
Yeah, I think that's a really important point, because people hear that they've got a condition or a risk factor and they go, well, I'm going to get it, or I'm going to be on medication. And there's the expectation, I think, for a lot of people that it's going to be a downward slide towards the progression of disease. And I love what you're saying. Your genes are not your destiny, pretty much. And 80% difference between twins related to lifestyle factors is really interesting, because it really does show that there are so many things, as you say, within our control that would help people to just avoid going down the path. I think the interesting thing is, for a lot of people, they have to feel some level of pain before they're prepared to make some change, right? So if we were to think about it from that perspective, what is the pain, do you think, that people need to experience, or the fear that they need to experience, to actually get them to take some proactive steps?
Melanie, that's the key thing, right? Like you can lead a horse to water, but whether they drink it or not is a different story. So the sort of clients that actually seek my support and help, they have a family history of a serious condition, whether they have the ApoE gene or whether they have like a family history of cancer, and they want to again build a legacy for their current family. They want to be there for them for as long as possible in health. So a lot of times it's whether they have an autoimmune condition. And with current medicine, nobody can give them answers as to what caused the autoimmune condition, whether it's Hashimoto's, hypothyroidism, whether it's endometriosis. So they are looking for answers for a diagnosis where it's multifactorial. They have got family like issues, or they might have belly fat, and they've tried all the different diets, whether it's the low carb diet, whether it's carnivore, and it might shift them for a couple of months or a year, but then it's not sustainable. And so really it's people who are frustrated and overwhelmed with the conflicting information, and they want to make changes because of pre-existing conditions or family history, and they're the ones who are most motivated.
Yeah.
But unfortunately, like, this free will thing that we have, like, it can be excuse my French, it can be a bugger. Because we all know, like, as a health coach yourself, when you ask the questions, people already know, like, the root cause of their chronic condition or why they're stuck, right? So it's like sometimes when they verbalize it, with a health coach who unpacks it, or sometimes it could even be a hypnotist, which unpacks like the trauma in childhood, etc. When that is verbalized and when it is brought to the surface, then they can just brew on it for a while. And then when they when they have a think about it, or something happens to a family friend or themselves, that's when the change happens. So unfortunately, at this stage, always there is a trigger that really help moves the change. But I wish it wasn't like that.
Yeah, it is a bit tough, isn't it? And I kind of see midlife as a really golden opportunity. Unfortunately, 80% of women have mild to severe symptoms. But fortunately, 80% of women have mild to severe symptoms, because that's going to be a trigger to get help, right? That's going to be a trigger to say, what can I do about this? Oh, my body's changing, my skin's changing. All of these things change without your permission. It's thrust upon you as part of your natural aging and accelerated aging. And then women are saying, well, what can I do about this? And perhaps also seeing their sisters, their mother, their family members who are further ahead and are struggling with chronic illness and thinking, I don't want to be that person. Or coming up with brain fog and saying, have I got dementia? Is this early onset Alzheimer's? I think that's, although there's a lot of discussion in the menopause space, you've probably heard about, we don't want to fearmonger, and we definitely don't. But I think there's also some breadcrumbs that we need to pick up and say, if you're experiencing any sort of symptom at all, why wouldn't you use that as a reason to go and get some tests done or a checkup and understand your individual risks so that you can optimize? I think the other part too is that we're really shifting the conversation towards, as you've already mentioned, longevity and health span. So I'd love to hear your thoughts on that shift in narrative too, Therese, about what are the
I love it.
benefits of that.
I agree that menopause is a window of opportunity. It's the time when that bucket of information many of us have been carrying for years, it finally unmasks that fatigue you mentioned, that brain fog, that stubborn belly fat, the anxiety. So what used to work doesn't work any longer. The body has changed. And it's not just a symptom of getting older. They are biochemical signals. So the Morpher survey, which looked at over 3,000 women, they found that 72% cited fatigue and low energy as their key top symptom, followed by brain fog and sleep disruption. Okay, how many women would put out their hands for fatigue, low energy, brain fog, and sleep disruption?
Yeah.
And think of it as a normal part of aging. But it's not just hormones, though. It's the bucket of inflammation we've been carrying for years, right? It's the stress, the general wear and tear of your vital organs, your heart, your kidney, your liver, processed foods, toxins, the desserts that we think, is a right for every meal. It's finally, catching up with us, and menopause simply unmasks it. And I mean, let's face it, like junk in the trunk, becomes jelly in the belly.
Yeah.
The average woman gains, 1,000 grams per year through the transition. Yes, estrogen is the marker that we see and that gets the blame. That I don't think that menopause is just a hormone deficiency. I think there's more to it. And belly fat isn't just a cosmetic thing. It's metabolic dysfunction where you're not breaking down your foods efficiently.
Yeah.
But I think the good news again is that this is a window of opportunity, that we can have insights of how we can reset our bodies to function for the next 30 years. So those pesky symptoms that you highlighted could be the trigger that we need to actually move on to a new sort of phase where we can actually live our God-given purpose with ease and confidence.
I love that.
Yeah.
Go ahead.
I was going to tell you about Sarah. Like, she's a 50-year-old client I saw who came to me saying, do I really need HRT? Or is there another way? She had hot flashes and she was sweating at nighttime. She had belly fat and she had this weight that she couldn't actually, like, she was accumulating over the years, and she just accepted it as part of her psyche, even though when she was younger, she didn't have any of that belly fat. We ran a DNA analysis and also lab testing. So it's important that you get the full picture. So DNA gives you one element of it, but the labs actually confirm like whether they have nutrient deficiencies or something else that is clouding that bucket of inflammation. So for her, we found that her detoxification pathways, how she breaks down food, alcohol, coffee, was diminished. It wasn't very efficient. Now, HRT, or menopausal hormone therapy, or bioidentical hormones, hormone replacement therapy, relies on these very pathways to break down estrogen into less harmful forms. Her labs also showed like heavy metals and mold exposure, all burdening our beautiful liver and our kidneys. So together we had to talk about, okay, would HRT, further increase that burden of toxicity? And if you look at the product information, which is readily available, any Australian can have a look at the side effects potential, the fluid retention, the mood changes, etc. It's real. So when you add things as well, you need to have to go in with your eyes open as to what you're getting. Yes, HRT, hormone replacement therapy, menopausal hormone therapy, bioidentical, may actually help reduce hot flashes. And there are clinicians who are advocating it for osteoporosis, etc. However, that we need to go in with our eyes wide open, that every time we add something like that prescribing cascade, are we actually adding side effects that we need to actually measure at baseline? And to also, the issue with HRT is, to use it safely, there is a window of opportunity, but use it for a short period of time. But a lot of times, a lot of women, they use it and they don't stop it and they go on forever and ever. So we must check, A, whether it's it's still effective, B, is it causing more harm, and what are the trade-offs and benefits that we're actually looking at for this particular agent. So what we did with this client was we went on an anti-inflammatory, low histamine, low sugar, and we went low gluten and dairy free. So after a couple of weeks, because we always measure and control, look at the symptoms, we have got symptoms questionnaire, and we have ads to actually food track. So we use a lot of technology to feed our database so that we know for this particular patient whether the current intervention is serving her or not. So with this particular one, her hot flashes, it reduced, her sleep improved, because if you have got hot flashes, it's really challenging to sleep in a comfortable manner. And her energy came back as well. So really it's going from what can we do that's the least harmful, and the one that she can actually sustainably achieve on a day-to-day basis. So I think DNA helps us personalize the strategy, detoxification pathway, but it also helps us to sequence care in a more safe and a more thoughtful manner.
Because the easy thing is to take a medication, and the hard thing is not knowing whether or how much is suitable for you, because we're still at the one size fits most with medication. We don't have that personalized understanding of how it's going to impact different people. And we hear these stories all the time of drugs and supplements being released, and then a certain amount of population have some sort of a reaction or an injury to that product because their unique biochemistry or system doesn't go well with that particular product.
100%. We really need to give customize it to the individual. So I've written a whole pros and cons, a balanced viewpoint about DNA testing and whether it's suitable for the individual. Because again, for some people, they don't like too much information. It can be overwhelming, and it works better when you have some support with the interpretation as well. So and cost can be a barrier. So I have like a 5-question sort of thing, whether DNA analysis for yourself. So I can actually send you the link to this article that I've written. I've also done a podcast as well on how to actually discern whether DNA test is really on.
That would be really helpful to link to, Therese, for people listening. Teresa, I should say.
Okay.
Talked about this at the beginning.
Yes.
Is it Teresa? I already had the other person in my head. One thing I did want to ask you about is the types of problems that you might see routinely when you're working with your client, when you're doing DNA and bloods or when you're coaching. Are there some really more common things that come up?
Yes, 100%. So a lot of times we are working on a very malnourished sort of foundation. A lot of women, they're super moms, they're super wives, they're super workers, and we need to match the output with the input. a lot of times women, they go gym 3 times a week. The sandwich generation, they're looking after older parents. They got adult kids, or they got this business, which if you're an entrepreneur, it's 24/7, and so everything you're on the alert. So each time you actually use energy, whether it's to achieve something, you need sort of like the raw materials to actually build your hormones, your estrogen, your adrenaline. You need all these hormones, and they're all interconnected. So a lot of times, how I explain to my clients is that if you're a car, the carbs would be your petrol. It gives you fast energy. Your fat would be your petrol in your jerry can, so for stored energy. And everything else in the car, from the windscreen wipers to the seats to the hood, is actually protein. And so protein is like the raw materials we require for healthy skin, hair, nails, muscle. And muscle is our metabolic support, where it uses up sugar, so it draws sugar from the blood. It regulates like diabetes and helps with metabolic flexibility. So a lot of times, Mel, I'm seeing that women, they are not eating 1 to 1.2 grams per kilogram target body weight of protein, and it's not like for like. So 30 grams of protein is about 100 grams of beef, chicken, or 140 grams of seafood, because there's more other things in our food products as well. So a lot of times we're malnourished because if we have none of the raw materials to make any of these good products to build this car, how are we able to function? And when we add protein, yes, there's a lot of controversy. Does it cause kidney damage? So we know that when we actually incorporate sulfur-containing proteins, it's going to add acidity to the system. So we need to balance it with enough vegetables. So how much is enough? There was a Spanish study that looked at what's going to reduce your inflammatory markers, your homocysteine, and your CRP. And they found that about 660 grams of vegetables and fruits. And this is a Spanish study. We need to actually tailor it to the individual. But it's a rough estimate that each time you actually add 30 grams of protein per meal that's required for muscle protein synthesis, you want to balance it with enough vegetables to ensure.
That's half a kilo a day of vegetables.
And so it's about the balance and about all the juggles that we have, all the balls we're juggling in the air. When you add something, you have to again sort of balance it with something else to again save and protect our vital organs. So for me, the key missing piece and the simplest thing is to prioritize protein for so many different benefits. But you need to protect your kidneys because a lot of times it's a silent disease that you can't see it getting more inflamed. And so the kidney damage that you hear about, those weightlifters, etc., is real because when you, as you know, weightlifters, they prioritize protein, but you need to balance it with enough vegetables and fruits to help reduce that burden of inflammation.
And getting enough protein is a challenge, and then getting the vegetables is another challenge. But I said half a kilo, but it's actually not that much really, because if you weigh out, I know I've done this myself, what does 150 grams of vegetable look like? Well, if it's a piece of carrot, that's already 100 grams, just a carrot, and that's one single serve of vegetable. So it's probably quite achievable for most people to eat that amount per day.
100%. So for breakfast, you might add in a shredded half an green apple, and you might add a couple of blueberries, and then you have some oats and Bob's your uncle. So it is about having that mixture. Lunch might be you add cucumber to your salad, and then so it's half your plate is full of vegetables, a quarter protein and a quarter carbs. It's a rough estimate of a good amount of balance that you bring, and that's more anti-inflammatory.
What about animal versus plant protein? I mean, firstly, there's getting enough protein, and I know that plant protein will have less than half, typically, the amount of protein content as animal protein. But what are some of the best proteins for women in midlife to be eating?
Love it. So the other day I had a client that was going through a cancer journey, and so she wanted to the main reason why she went plant-based was she's got 2 kids and she wants to be environmentally sustainable. And then when she showed me like what she was eating from her freezer, it was those corn, QURN, sort of like processed ones.
Yeah.
So I said, okay, have a look at the back of the ingredients list, and if it's more than 6, then it means that it's your body will have plant material plus additives, flavoring, because you need to have the right texture when you actually make plant-based versions of spaghetti bolognese, for example, and then you have to add more flavoring to actually make it a bit more tasty, because with texture, and a taste and that sort of thing, that you're looking at, we look at my list of medicines that's 30 or more, you look at this back of this process like packet, it's probably about the same as well. So I think we make decisions, but I think we need to think about, okay, if we want to save like animals, we want to again be compassionate and kind. As humans, we omnivorous. So it is everyone's choice. It is harder to actually get all your amino acids just on a plant-based sort of version. It requires a lot of thoughtful discussion about what sort of supplements I require to fill that gap in with the B12, because the plant-based versions, they're not as absorbable. You might need like a whole gallon full versus like the amounts you get from red meat offal. So it is a thoughtful process. So many people default to pea and rice protein. It's important to actually have a think about, if we're concentrating on that amount, a house full of peas to make that, how much pesticides are we adding to our body? It's one of the questions I ask. Like, are they, other people you are using, third-party testing for any pesticides and any toxic like substances that might be even more harmful because you're trying to be plant-based? How I actually work with my clients is we do need shortcuts, and it's very, very challenging to prioritize 30 grams of protein a meal. So a lot of times for breakfast, to get there, we might use whey protein isolate, which is like 90% sort of lactose free. And so I choose ones which have got no fillers, flavorings, additives. So it's like a creamer. So you might be able to put that in your bowl of porridge or oats in the morning. So it's how we can actually do it incidentally. And so 3 scoops might get you that one version of that. And so it's like you try your best to actually get there. And at the beginning, you might require an app to help you track. So I give my clients the paid version of Chronometer, which can actually double click to the micronutrient level of how much they're ingesting, so that we know how much supplements and how much like of the more processed versions that we actually include. So we try to again do it best with diet. But for some people, you need to have some assistance and support. And then we use like whey protein isolate, or we choose like a pea protein that has been third-party tested for all the pesticides.
Yeah, it's such a great point that using supplements to meet your protein needs requires a bit of caution in terms of fillers, other ingredients, pesticides, toxins. It's a really important point, Therese. Thank you for mentioning that. And I suppose the other thing too is that if you are purely plant-based, there's how do you get enough iron as well? And of course, the omega-3s, you don't get the full suite of omega-3s, only the plant-based ones. So there's lots that needs to be attended to if you're going purely down that path. Yeah. Therese, thank you so much for your time today. It's been really interesting talking to you about some of the unique cases. I think that really highlights the fact that we are all different and we have different needs, and also that there are some things that can help you to get answers and the right support more quickly rather than just groping around in the dark. And I love your mention of health coaching as a way of helping people to come up with their own personalised solution, but also to stay on track, because consistency is the hard part. As you said, making it part of everyday life, making it incidental is the way to be successful. Is there any last thought that you would like to share with people listening to this podcast today?
Just re-emphasizing that optimizing health goals can be easy if you surround yourself with the right team. And so that's why I love working alongside coaches. I think it's about translating complex information into practical bite-sized action that's sustainable and customized. So when you understand the DNA, you skip years of trial and error. and it can help give you a bit of a shortcut, but it's not perfect. So I think it's about using as much support services that you can afford to help serve your health. So that's probably where I would actually finish.
Thank you. And I want to add to that something I've just thought of. It's also not for life. You're not going to work with this team necessarily for the rest of your life. It's not like taking a medication forever and ever. It's something that you might do for a period of time to get it right, and then you might check in incrementally. But in the end, it's going to be a lot lower cost to do it that way than it is to be unwell and to just sign up for a whole bunch of stuff that,
Yeah, I think the cheapest spend is if you get a health coach and then they help unpack like why you're stuck. They ask the right questions, and whether it's food addiction, food cravings, whether it's being too bored, like with the current system and snacking on the ball, having that could just change your habits and be the easiest way to move forward because the growth mindset, it trumps all the different interventions that's out there. When you can do something different, you get different results.
Thank you so much, Therese. It's been really lovely speaking to you today. I hope people have found this helpful, and we will link to some of the information you talked about in the show notes.
My pleasure.